Auzubillahi minash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. I hope you people are doing well and fine. In this video, we will discuss a possible scenario of a case of retinal detachment. Retinal detachment is defined as separation of retinal pigment epithelium from neurosensory retina. And if you know the subject, then you should be able comfortably to pick up the answers in the MCQs and SAQs. So you need to study the retinal detachment and its types. So the possible scenario can be a 35-year-old high myope male presented in eye emergency with sudden loss of vision in his left eye for the last 1 week. On examination, the vision in the right eye was only counting finger, and the vision in the right eye, which is a normal one, is 6/6 with glasses. On examination, it was found that he wears -8 diopter spherical lenses since the age of since when he was very young, and he was experiencing the symptoms of seeing the floaters in front of the left eye. After a few days, he started experiencing the flashes of light, and then he suddenly lost his vision. So this can be a typical scenario, a very easy scenario in which there are a lot of hints towards the retinal detachment and rhegmatogenous retinal detachment, that is the detachment with the break. First hint is the myopia. High myopes are associated with rhegmatogenous retinal detachment. Number two, flashes, which is due to the vitreoretinal traction and floaters. So these are the clues which should guide you very easily towards the diagnosis. So the possible steps can be: number one, name the diagnosis. The diagnosis is, as there is no other findings are given in the examination about the extent of the detachment or some whatever, you can simply or safely write the diagnosis is rhegmatogenous retinal detachment with possible macula off. Means macula is also involved. That's why his vision is so low, that is 6 counting finger. Second step can be enlist the types of retinal detachment. You know there are 3 types. Number one, rhegmatogenous retinal detachment, that is which is because of a break. Tractional retinal detachment, which is because of some diseases, the most common of which is diabetic eye disease, and in the later stages it causes vitreoretinal tractions because of new vessels, and the traction of the neurosensory retina causes the retina to be detached. So the second one is the tractional retinal detachment. Third one is the exudative retinal detachment, which is because of some disease behind the retina, in the choroid, in the sclera, like posterior scleritis or malignant melanoma, and there are some syndromes like Harada syndrome. So the third step is name two methods of treatment of this disease. Number one, scleral buckling with cryotherapy. Number two, posterior vitrectomy. Posterior vitrectomy, because it is a case of fresh retinal detachment, so scleral buckling with cryotherapy will be enough. But in later cases, if the patient presents late, then PVR develops, that is posterior vitreal traction and lateral folds. So for that, posterior vitrectomy is also needed in older cases of retinal detachment. So retinal detachment should be repaired as soon as possible. And a very important point, the prognosis is good or poor depends upon the involvement of the macula. If the macula is not involved, the prognosis is good, otherwise it is bad. Lastly, even if the vision is not good, prognosis is not good, even it is PL, every retinal detachment should be repaired, because if you don't do it, then other complications like rubeotic glaucoma or paradoxically very soft eye, a painful eye, these can be the complications. I hope you would learn a couple of things from this video. Write in the comments please, what do you want to hear about, and here I would stop. Thank you very much for watching. Allah Hafiz.